Hello guys, how are you? Hope you had a great week with your family and loved ones. Yes, I have a different hair color and a different haircut, so welcome holidays. Today I'm going to be addressing what I learned about the case reports presented by my classmates Shannon and Billy and the case report of my client Susana. First, I would like to talk about radio. As my classmate Billy stated in his case report, James Robert Kennedy Radio is an 18-year-old single male who has mental disability since birth. He has been referred for vocational rehabilitation services by the local high school coach. Billy added that Radio does not know how to read, write, and he has limited verbal abilities. Radio has never been given a medical diagnosis for his condition. His mother states he is just lower than the most. Radio's case is complex and will require a thorough assessment and a collaborative care plan with multiple interventions. Billy states that Radio's reading, writing, and verbal communication skills are minimal. His vision and hearing are normal. He has deficits in gross and fine motor skills, which impacts his ability to perform complex physical chores and write. I totally agree with Billy in his effort as Radio's counselor to improve Radio's communication and social skills in order to promote greater independence. Billy developed a plan of action for Radio which includes Assess Radio support system and including the plan. Radio support system includes his mother, Coach Jones, and some of the high school staff. Radio's mother will be instrumental in ensuring Radio gets all his testing therapy appointments as well as for provision of care. Coach Jones and the high school staff will be beneficial in assisting with social skills training, development of appropriate IEP, and possibly with assisting in securing employment for Radio. Billy also suggests for Radio to apply for Social Security disability and supplemental security income. Social Security benefits are instrumental in providing for basic needs and improving the quality of life of individuals with disabilities, particularly if they are low income. Radio's mother will qualify for SSDI since Radio's disability manifests before he was 22 years of age. Securing this benefit will alleviate the variety of financial constraints that his mother has. Coordinate speech and occupational therapy services. Therapy works by restoring or compensating for loss of functioning and helps improve rehabilitation outcomes. The speech therapy will be beneficial in improving Radio's verbal communication, and occupational therapy will help Radio learn to perform basic and complex ADLs, which will increase his independence. As I think about Radio's situation in reviewing Billy's suggestions for him to apply for SSI benefits, which notably will allow him to receive income support and other non-beneficial services like Medicaid, I am also wondering what activities will be best to work on his communication skills aside from taking speech therapy. As Billy mentioned, Radio has minimal expressive communication skills, and this can interfere with understanding instructions, process information effectively, and perform critical job tasks. Nevertheless, I really like the way Billy developed his plan, as this assessment can help determine the supports and working conditions that will be needed at school and especially at a job site. Moreover, the case report that my classmate Shannon presented is a reflection of my own client, as Shannon states that John F. Nash Jr. is a 31-year-old male married to his wife Alicia, who is currently pregnant with the first child. He has been referred for vocational rehabilitation services by his psychiatric, as Nash recently has started to display more concerning symptoms such as hallucinations, delusions, abnormal motor functioning, mumbling, disorganized thinking, and muddled speech. He has also created several relationships with fictional individuals who he sees as being real, however, they are in fact delusional as part of his imagination. Shannon added that Nash family has recently discovered that one of these relationships has been going on for several years. This relationship is with Charles, his colleague roommate at Princeton. Nash is the only person that has ever been able to see him or talk to Charles. His wife recently confirmed with the school that he had never had a roommate while being at Princeton. My classmate also notes that another delusional figure in Nash's life, a spy named Parcher, has recently convinced him that he's working for the government and is involved in top secret information related to national security, although he's not. His delusions and paranoia have recently pushed him to a point where he is not able to function emotionally, socially, or professionally. He is struggling to maintain his work life along with personal relationships. Shannon shares that Nash has also stated that he would like to return to work in some capacity so that he can put his valuable knowledge and education to good use. The following are identified service recommendations and supports created by Shannon in order to support Nash in obtaining his goals. Shannon suggests to enroll Nash in a cognitive rehabilitation program to focus on his neurocognitive impairments and increase memory capacity, attention, and problem-solving skills, ultimately assisting with a higher level of independence. Psychiatric planning and supports through a psychiatric that is able to assist Nash in medication management and planning, ultimately assisting him to find alternatives to medication and a safe and appropriate step-down plan if he chooses to discontinue his uses of antipsychotic drugs. Assist Nash in connecting with local support groups for individuals with mental disabilities, especially schizophrenia, to increase his level of natural supports and to provide a positive and safe emotional outlet. I do agree that Shannon did a great job catching paranoid behaviors as an area of primary prevention. I also like how she pointed out that psychiatric planning and supports through a psychiatric will be able to assist Nash in medication management and planning. I also feel his breakthrough delusional thinking and hallucinations can distract with psychotic disorder and hinder co-worker and supervisor relationships that can lead to unstable employment. Nevertheless, the plan of action that Shannon developed to assist Nash with his mental illness and stable employment outcome. What I learned through the discussion about the case report that I developed is that delusions and hallucinations can really push a client to a point where he or she is not capable to function emotionally or socially. My client, Susan Callahan, is a 21-year-old journalist at the New York Post who is induced by voices in her head and severe seizures. She has been referred to vocational rehabilitation services by her neurologist as she struggles with a rare neurological disease, making her lose control of her mind, emotions, language, and loss of autonomy that creates a haunting imagery of medical practices where Susanna has neither control nor ability to give consent. Her illness, anti-N-metal D-aspartate receptor emphyselis, is a newly revealed disease where individuals present with a change in mental status, bizarre behavior, and seizures. Susanna also deals with hallucinations, personality disorder, psychosis, and insomnia. Her hallucinations and paranoia have affected her professional life as she's not capable to process information effectively and perform critical job tasks. A plan that I developed for Susanna as her rehabilitation counselor will be working with her support system. This group will consist of her parents, Tom and Ronna, and her boyfriend Stephen, and her best friend and co-worker Margot. In the mounting and withdrawal stage, Susanna may segregate herself and may soon follow with undesirable thinking in the succumbing and depression stage. Excessive depression can lead to a range of physical and behavioral symptoms such as abundant feelings of desperateness and even suicidal thoughts. The reassessment and reaffirmation stage will lead Susanna to find meaning in life in order to reach the goal of personal growth and move on with her life. In reviewing Susanna's history, there are several treatments that should be considered in developing medical and rehabilitative plans of care, and they are identified as follows. I will obtain primary physical records to obtain and review all medication she's taking to see if it will not interfere with future employment. These records may also identify other conditions that Susanna is unaware of that can impact employment. Susanna's support network and medical providers should encourage a low-stress environment to reduce the likelihood of stress-related illness. In addition, I will empower Susanna to set goals for a healthier lifestyle to prevent consequences of erratic behaviors. I will also assist Susanna with accessing community resources to help educate on treatment strategies to minimize the effects of anxiety, depression, and dementia. I will enroll Susanna in professional therapy. Her therapist can work with her to modify attitudes, expectations, and beliefs and identify and adjust maladaptive thoughts. Also, my classmate Billy expressed that assessing her cognitive mental state could be achieved by using the mini mental status exam. He added that using the Myers-Briggs personality exam will be helpful in helping her find careers that match her personality type. Since my client also has neurocognitive challenges, it will be important to access for DSM-5 and ICD-10 psychiatric disorders using the mini international neuropsychiatric interview. Additionally, Billy stated that by using the DSM-5 cross-cutting symptom measure will be helpful in further assessing my client's mental health functioning. Billy also appreciated how I included her family in her care plan, as this promotes trust in the counselor and the client-family relationship, which is important to improve outcomes. As a vocational rehabilitation counselor, I can help Susanna to be attentive of her life and surroundings, concentrating on moving forward and thus assisting her to be positive and amid the